on the muscles that we want to inject on the practice day. So we're going to target the glabella complex, forehead area, and crossfeet. Let's start with the glabella complex. Glabella complex is one of the very important area of the upper face because we have very strong muscles here that they make facial expression and they make the frowning, they depress the eyebrows, and they can make a very important aging sign, which is the 11 line here, right? Which is usually by the contraction of these two muscles here on the side that we call it corrugators. In the center, we have the procerus muscle, and usually at this area, I'm showing you that in the supramedially part of the orbicularis or oculi muscle, we have fibers that some people, they call it depressor supercilii. Still, some of the anatomists, they don't consider this muscle as a separate muscle. Some people, they think this is a separate muscle. But the most important muscle in the glabella complex is definitely corrugator. Okay, so all of these muscles are depressor. They're bringing everything down. Starting with the procerus, usually the procerus, the fibers are vertical and it makes a horizontal line in the upper nose. When you're injecting, as this muscle in the lower part is very deep and almost at the bone level, you're injecting deep. Basically, the whole needle of your insulin syringe goes 90 degrees in and you're almost injecting at the level of the bone. Okay, the average depends on the size of this muscle, can be between 5 to 7 units of Botox. All the units I'm going to tell you would be Botox Allergan, not this sport. Okay, when you're injecting the corrugator, depends on the size of the corrugator and how broad is that. Sometimes you have to inject the head of the corrugator and the tail of the corrugator. Sometimes you're just injecting the head. Depends again on the size of this muscle, which you can just find it by the examination of the patient. When the patient frowns, you will look, and then when you see where the dimpling of the skin is usually the end of the corrugator. Typically, in male client, this muscle is wider. In female clients, in Asian client, is usually shorter and it goes upward. That's just typically, but you have to examine every single patient to find the anatomy of this muscle. In the medial part, this muscle is usually very deep at the level of the bone. And as it goes to the lateral side, it gets more superficial and at the end is going to attach to the skin. So therefore, when you're injecting the head of this muscle, again, you have to go deep. The whole needle goes inside and you're injecting. As you go to the lateral side, and if you want to inject the tail, you're injecting subdermally. Basically, you're injecting very, very superficial. Okay, and the amount of the toxin that you're injecting in the medial part is usually a little bit higher, maybe 3 to 5 units. But as you go to the lateral part, the amount is going to be less because the bulk of the muscle is less as well, maybe 1 unit or 2 units max in the tail of the corrugator. Tail of the corrugator is a very tricky area because as you can look at, you can see in this picture, there is a very important muscle here, which is the levator palpebrae superioris. This muscle lifts up and opens the eye. If your medication spread to this eye, to this muscle, it makes eyelid ptosis. Right? That's why you have to be very careful when you're injecting the tail, not deep injection, not by force, not a large amount. Otherwise, your product will go to this muscle, the palpebrae superioris, and the patient will get eyelid ptosis that sometimes can last for a few weeks, which is not going to be nice. I'm going to show you a picture of that. Okay? So the average amount of the glabella, which is also the approval for the Botox Allergan as well, is around 20 to 25 units of Botox in female patient. In men, usually we need more. Why? Very obvious. The muscle mass in male client, it is always bigger than the female client, right? So technically we need more toxin to get the same result in male client compared to the female client. Okay? Let's move to the forehead. In the forehead, we have a very important muscle, which is the frontalis. It's a wide muscle. It has very anatomical variation. I'm going to show you on this slide here. As you can see, we have different type of frontalis, type 1, type 2, type 3, type 4. And again, all this type has been explained in details by my very good friend, Dr. Talani, on his anatomy videos. And how you can find which type is the patient, you have to examine the patient, right? And then you decide where to inject. Like, for example, someone who has type 3, he doesn't or she doesn't need any injection in the lateral part of the frontalis because there's no muscle there to inject, right? Or someone who is type 4, you don't need to inject anything in the center of the forehead because there is no muscle there, right? You don't want to waste the product when there is no movement there, when there is no muscle there, okay? And again, how you find it is always by examining the patient. Something that's very important is frontalis muscle is part of the frontal occipital complex. It means that this muscle is attached to the occipital muscle by the glia. And this muscle has two actions. The fibers in the lower part of this muscle, they lift up the eyebrow. The fibers in the upper part of this muscle, they bring down the hairline. So there are depressor in the upper part, elevator in the lower part. And that's why when you're injecting toxin, you should try to avoid to inject in the lower part of the frontalis. Otherwise, you will lose the tone of this muscle and the patient will get eyebrow drooping. So we have eyelid drooping and eyebrow drooping, right? Which is usually when the medication has spread to the lower part of the frontalis, right? So we always inject the upper part of the frontalis. Okay, and one of the very common injection technique is multiple injection. Each injection should be at least 1 centimeter apart. And usually what I do, I always do like a zigzag. I go up, down, up, down, up, down, up, down, up, down, multiple injection. Each point 1 to 2 units max, right? In male clients, I usually inject 2 units each spot. In female clients, I usually inject 1 unit each spot. Right? So the average amount can be as low as 6 or 8 units. It can be high as 20, 25 units. Depends on the strength of the muscle, depends on the size of the forehead. We know that, for example, male clients, they usually have a longer and wider forehead and stronger muscle. Definitely a male clients might need 20 units for forehead to get the same result that a female patient get with the 8 units of Botox.